Cindy Floyd. I'm the school nurse liaison with the Idaho Department of Education. So today we're going to talk about stomach problems and how we triage stomach problems at the school level. So we'll review the abdominal anatomy. We'll go over that fairly quickly. How we assess in a school setting, the inspection, auscultation, palpation, and percussion. And then how do we determine the seriousness of the complaint and then recognizing the outliers and when we refer. So TY is sent to the nurse's school office before her class, and her chief complaint is that she's got the worst tummy ache she's ever had. She feels like she might throw up. When you ask her what her pain level is, it's 10 out of 10. She's already seen her teacher about it. She's been sent to get a drink of water. She's also been told to go to the bathroom, and all she wants to do is go home. Her vital signs are normal. She doesn't appear toxic. She's sitting upright, and her facial expression does not match the 10 out of 10 that she's telling you. So as we think about stomach and kiddos coming in, knowing what is underlying in each of the quadrants is super important, knowing what's superficial and what's deep. So as we divide that plane into 4 quadrants, we have the upper and lower quadrants, right and left quadrants. And at the school level, we think about right upper quadrant. We really probably don't see a lot of stuff to do with right upper quadrant. We have our liver and our gallbladder in there. As obesity kind of takes over, that is something to think about as we get our older students. If you're in a high school level, we may have a student come in that we may see having pain up there. When we think about the left upper quadrant, enlarged spleen, maybe due to mononucleosis. We had a nurse that experienced having spleen tenderness. She was talking about, she thought it was really odd. Anyway, when she did send the kiddo back in, she got the whole story. He actually had injured his spleen and it had a slow bleed. So when we move down to the right lower quadrant, we think about the appendix and constipation because we have the large and the small intestines. And then the left lower quadrant, same, the small and large intestines down there. So it's super important to initially get the subjective and objective information, and that's kind of where we get started, asking them the questions, what's going on? Why are you here today? Tell me what that feels like. Have them rated on the scale, or if you have the FACES chart that they can use, asking them questions like, when was last time you ate? What did you eat? Have you ever had this pain before? Talking to them about their bathroom. Have you been to the bathroom? Water intake, I think, is always important. And then doing the objective, measuring the data, the vital signs. In here, we put lab results and physical exam findings. But knowing, does what they're telling you really match what you're seeing, and being able to decipher between the two. And then as we move forward, I can change the slide. Doing your abdominal assessment is super important. So knowing the 4 basic skills that we need to do, and then what sequence we do them in. Next slide. So initially having them lay flat, I have them come in and lay flat on my exam table and be able to just observe them. Sometimes I'll even get down on my knees and look at that stomach. And what we should see is usually the flat or the rounded stomach. That's our normal findings. We see more protuberant stomachs now with the obesity going on. And then the scaphoid, if we're seeing that, we might be thinking malnutrition. With that, it's super important that if we're seeing something that doesn't look right, that we keep that in the back of our minds. One thing that you can do is have them cough or bear down, and that might make things a little more clear for us. I'm going to plug in my computer really quick so I don't lose you guys. I'm sorry.
In the meantime, does anyone have any questions so far?
So sorry about that.
That's okay. Just asking to see if anyone has questions so far.
Okay. Then we'll move on. Our next part of our skills that we'll use is the auscultation. So using the diaphragm of your stethoscope. We know that peristalsis is what creates the sound that we hear, and we'll want to listen in each quadrant. We all know vowel sounds that are normal. They're the high-pitched or low-pitched, intermittent. We shouldn't be hearing continuous sounds. If we're hearing a continuous sound, the things that we might ask about is, have they had diarrhea? Food poisoning is another one that will give us continual sounds. We start to listen in each quadrant, moving clockwise, but we do want to ask them where they're hurting because that's the last place we'll listen. So if they're pointing to or saying that their right upper quadrant's what's hurting, then that's the last one we'll do. But usually you start down low and go clockwise. And we want to listen, truly, if we're doing a good assessment, we'll listen for up to 5 minutes. And we don't say that they don't have vowel sounds unless we haven't heard anything for 5 minutes. We can go to the next slide. Next, we'll do palpation. We want to do light palpation starting with just one hand. We use our fingers, we lay them flat. I have our little guy over here. So we want to start with just one hand, feeling. And then as we're doing that, we're wanting to do the circular motion and we move from one quadrant to the next. What we're feeling for is any masses that we can feel, if there's any rigidity or if there's any tenderness when we are doing that. And one thing that I think is super important while we're doing that is that we're looking at our student while we're doing that and watching what their facial expressions are. Kiddos can be in a lot of pain and they won't say they're in pain. They're usually not sent to my office because they've complained to the teacher. They're sent to the office because the teacher notices there's something different going on with them today. They're not interacting like they usually do. Maybe they weren't playing at recess. So I think it's really important that we're watching facial expressions while we're doing that. And then percussion, using your middle finger, you use your non-dominant hand on the patient and then using your dominant hand to do the percussing. It's super important that we get used to doing this, practicing this, and knowing what sounds are normal. So if it's air-filled, it makes a different sound than if it's over an organ or over fluid. And it's very common in the school-age kiddos that what we're going to hear is due to gas. Go to the second. So when we think about what we would see our students for, constipation and stress are probably the two I see the most at our school. And a lot of the constipation is due to the poor diet kids have and then the lack of water intake that they have. So always a good time to talk about and educate students when we have them in our office. I think it's super important when we get any time with our students that we're doing some kind of education with them, especially if they're not in a ton of pain where they can learn. Indigestion, asking questions about what they ate, what kind of foods. The hot talkies are the big thing around here now. So talking to them about when their last intake was. We discussed when the last time they had their bowel movement, which I always find funny because they get all nervous and embarrassed to talk about it. And nurses, we love to talk about poop. When we talk about stress and anxiety, I think this is one that is a super great opportunity to teach coping mechanisms, to talk to students about ways to handle their stress, talking about what the triggers are. One of the things that I have found is being in a rural area, a lot of our families don't talk about mental health or having stress or anxiety. And so I think that opportunity is super important. I teach box breathing or deep breathing, knowing what triggers a kid and knowing when to walk away from that. And I think those skills can be taken lifelong and passed on. So I find that really important. Um, Other things that we might see but are kind of outliers at the school level, appendicitis. So if your student comes in an intense amount of pain, if that pain, when you do your palpation, intensifies, or if they have rebound tenderness, so you're palpating and you pull away and it increases their level of pain. Um, any jarring or coughing makes it worse. That's a time that you would refer, have a parent come get them and take them in. Um, Bowel obstruction, getting a good history of what have they had liquid diarrhea? Have they not had a bowel movement? Did you really truly not hear bowel sounds? Those things are important. And then having that conversation with the parents, how it's important to go in and be checked out. And then UTIs, talking about their frequency, things that they've noticed about their urine. Teachers are usually the first person that says they're in here constantly, they're having to go to the bathroom constantly. Maybe it's a younger child that's having accidents at school. So when we talked a little bit about when TY came into the office, she came in, it's right before her math class, that she's kind of been the frequent flyer. So she comes in quite a bit. It's usually non-specific. I've got a headache. I don't feel well. I need to be checked for a fever. Um, what are some things that you guys want to ask her?
And we can have some people unmute, or you can put some responses in the chat. I'm going to go back to that initial slide.
Sure. I guess the second one, second or third. There you go. Worst tummy pain ever, 10 out of 10, but her facial expressions aren't matching that. She doesn't look toxic. She's able to sit upright. She wants to go home.
I'd want to know where her pain is.
Okay. If she's not able, it just my whole tummy hurts.
Cindy, there's some things coming into the chat. So the first one is, do I see her at about the same time each time?
Okay. It's right after, it's after lunch and it's during math class.
And then next is, did you eat? So it's a question, I guess, for student, did you eat today? What did you eat?
She normally eats, she brings a lunch from home. Parents pack a pretty healthy lunch and she always eats what's brought.
Couple of food questions. Onset, duration of pain. When did it start?
Okay, so good job asking about the bowel movement. She normally says that she has bowel movements, that isn't a problem. I've asked about water intake. She carries a water bottle. The only time she can't have it is in music because our music teacher doesn't allow it in the music classroom. Is she learning the subject in class, looking for a trend? So the trend is it's always math class. So the more I got to talking to the student, math is really hard for her. She struggles at it. But it took me a while because she came in and she's pretty convincing. She was a frequent flyer. So even if I wanted to try some Tums and see if it helped a little bit, they don't treat. So what are some of the things if you do believe that this is stress or worry related? We know we can't treat and we know that there's a trend. What are some suggestions or things that you might try?
We'll wait for some things to come in the chat, but in the meantime, does anyone want to unmute?
Cindy, you said, oh,
No, go ahead.
Cindy, you said you like to teach box breathing, and what was the other thing that you said you like to teach in your
Deep
office?
breathing. Yeah,
Oh,
deep breathing.
I would maybe try those.
Okay. Anything else in the chat coming in? A warm pack, great. I like talking to the teacher, so super important.
Cindy, had you spoken to the parents before? Are they okay with you seeing her?
Yeah, they do. I've been in my community for a long time, and I'm lucky that way. Just I have a pretty good trust within our community, and then I usually call out to them and just say, okay, this is what we're seeing. What would you like me to do from here? Do you feel I give them the option if they want to come pick up their kiddo or if they want me to try some things. So the rest in a quiet area, taking a walk, love. Those are the things that we implemented. So we reached out to mom. Mom actually, she allowed us to put her daughter into counseling for some support. Another thing that we did was when you said take a walk, her trigger was coming into math class. Once she got in and got kind of into the assignment, she did okay. But it was just getting to that point of getting the book open and getting that assignment going. We have teachers' aides that go into the classrooms. And so what we implemented is putting a teacher's aide in this classroom just to help her get into class and get the book open and get into whatever they were doing that day, the lesson that they were doing. That helped. But she also has a hall pass where if she feels like she needs to get up and go take a drink of water or even swing by my class or my door, she's allowed to do that. In the beginning, it was way frequent. And we're in year 2 now of this. This was last year that we started this. But what her mom did at home was if she didn't come see me for 4 days in a row, because for a 4-day-week school, she got a sticker at home. But her mom also told her, if you're not feeling well, I'm not going to take your sticker away for going and seeing the nurse. Like, I don't want you to not go see Cindy. But if you're just going in there because you feel overwhelmed. And so we put that into place. The open communication with the family was super important. Her knowing that mom and I were talking, that we had this open communication back and forth, I think was really important. The teacher also was instrumental in making sure that her aide that was in that classroom, normally they do copies and run their errands and do different things, but having that person be welcoming at the door and taking TY to her seat and I'm glad you're here today. What are you excited to learn? Those things was super important. Taking the opportunity to teach her coping mechanisms that she could do on her own in the classroom without having to leave, I think was important. So she did the deep breathing or the box breathing where you take a deep breath in, hold it for 4 seconds, let it out for 4 seconds, rest for 4 seconds, and doing that box breathing was super important. Her mom doing the sticker thing. And so as the year went on, I didn't see her anymore. In fact, if I saw her in a hallway, it was a big deal. Like she was excited to see me. And we did really well the rest of the year. Then we started the new year with a new teacher. So that was anxiety producing for her. New teacher and the older teacher didn't talk about what was going on until about 3 weeks in. And so that was delayed what we were doing. She had quit doing counseling because she was doing so well. They had weaned her off the counseling. We brought that back on for a couple weeks just to get through that initial new math class. She loves math this year. Math is easier for her this year. And about, I would say probably 4 weeks into school, she was fine again. I think it is super important when we have kiddos that are frequent flyers that we are implementing teachers within that discussion. If you have counselors that are available at your school or outside counseling available, super important. Getting the skills that can help them learn to cope. Coping mechanisms, I can't tell you how important they are. People that lack coping mechanisms, when they get older and they don't have them, a lot of them turn to substance use. Mental health becomes an issue. And so I think when we teach those early and that becomes something that they just turn to, super important. You can go to the next slide. So things that would be abnormal on our assessment, if we were doing palpation, light or deep, and we found tenderness, different parts of the abdomen, we know what quadrants it's in. Rigidity, so involuntary stiffness of that muscle in the wall, any guarding. So a student doesn't want that they tense up, don't want you to touch them. Rebound tenderness. Those are acute abdominal findings that we would want to refer on. Any discoloration, bluish coloration. I will say I don't lift a kid's shirt to look at color in the school setting. Maybe when a parent gets here and I have them on site, that's something I would do. I've never had to do that. And then also the bowel sounds, knowing missing bowel sounds can be more serious. So being able to refer parents to my best, in your best interest of your child, but also I feel like what, as a nurse, it's beyond where we are in our scope and that you need to get them in. So appendicitis, knowing McBurney's point and the tenderness, having them get up on their tiptoes and fall back to their heels and jarring makes that pain worse. Next slide. Doing tapping on their tummy for the percussing. We've talked about this. And then just the UTI, any flank pain, lower back pain, pressure. Where I see kids as a FNP here, parents will come in and see their kids will do a urine test here. Any urine incontinence of a kid that's not normally incontinent, going to the bathroom a lot or having the urge to go to the bathroom, always important. If they say they have blood in their pee, super important to refer on. Hopefully we never have to deal with this, but any changes in bowel movements, having super watery diarrhea or not having a bowel movement, saying that they have blood in their stool, bloating, cramping, unexplained weight loss, and any anemia, that being tired, just a change in who they are, the way they are at school, super important. Having that conversation with parents that they need to go in and get an exam. And it takes a village. We're part of that village. One of the things that we've started here at Marsing, and it's new this year, is we call it the flex room, but it's a room that kids that are kind of dysregulated or anxious can go. They can go for 5 minutes and there's pinwheels to blow on. There's colors, walls got art on it that they can color, different textures, weighted blankets, my little blue doll over here. There's a lava lamp. It's lowly lit. They can get their break, and then the counselor or and then we also have BSU students that do internships out here, will be in that room to help them through that. We teach them breathing techniques, kind of assess if this is something that's ongoing, should we be talking to parents about doing a referral to counseling. And we feel like this has really been helpful, especially for our kids that really dysregulate. And then just having teachers aware of kids that they come up and they're saying they have a stomach ache. We used to have the teachers would say, go get a drink and come back. But I think we need to educate our teachers of that this can be a sign of somebody that's got some anxiety going on and stress that's going on, and that ignoring that only makes it worse as they get older, because then they don't seek out the help that they need because they've been told that they're fine. So I think super important to relay the message that we can learn different ways to cope and being able to teach those. And there is a lot of stuff, good information out there on how we can implement easy tactics to help students. And I would love to open it up to conversations on things that other school districts are doing or things that you've seen as far as gastro stuff at your schools.
Thank you, Cindy. Yep. So we're going to open it up to questions, or also, like Cindy said, if there are, what are you currently doing at your school, or what are some maybe other things that we should be looking out for?
I'll open it up. Thank you, Cindy. Good case, good presentation. And I think someone pointed out in the chat, and you had mentioned also, Cindy, that having the student point to where it hurts is important, because usually, especially if it's a student like the case today, it's going to be this. And then you say, well, do it with one finger, and then they'll do one finger and still basically point everywhere. The more they do that, the more reassuring it is, right? But if they take that finger and they point at McBurney's point, it's different. So that's a nice little pearl to use to try to triage. And then for the older students, maybe knowing when their last menstrual period was can also be helpful, because the lower the abdominal pain in females, in adolescent females, then that opens up all those other anatomy things that you have to think about in your differential.
Thank you, Noreen. Anyone else?
I'd like to hear other cases from nurses, especially if you've been doing this long enough. You've had the child that did not have the typical presentation. I had a student in Boise who seemed like one of these kiddos that maybe it's just some anxiety, always into the school nurse, but ended up having inflammatory bowel disease. And really the only way that it was caught was weight loss. So even though he did not have any specific, he was very non-specific, generalized abdominal pain, and yes, he was a frequent flyer, I think it was noticed by the school nurse that he was actually losing weight, and that was the biggest clue that there was something else going on. Does anybody else have an interesting case like that?
I could share one. I don't know if you can hear me very well. I'm in my car actually.
We can hear you perfectly.
Okay. So I had a that kept appearing in the bathroom crying with a little bit of loose stool in his underwear. And they'd call me down. They'd say, he's in the bathroom again. And I'd go down, and he was never incontinent before. And it was just kind of something new. And what I kind of figured and suggested to the mom was that sometimes there's a case where they can be so constipated, impacted, that the stool is leaking around the block. And so the kid can't even feel really that there's any stool coming out, but it's just kind of the juicy leaking around the blockage. And so where she thought he was just having diarrhea once in a while, she actually took him in and x-rayed, and he was super constipated. So it was just kind of something that's different than what you normally think that you're seeing. So
that's a good example, because that's actually way more common than we think. I know I see it all the time, where yes, they think it's diarrhea, but it's actually the absolute opposite, where their rectal is so stretched and has been stretched for so long that the receptors in that area just don't even know that you need to go. So they'll go a week or so without having a normal bowel movement. And at a certain age, the parents may not know that. So thank you for that example.
I think to follow up on that, one of the most difficult things is helping parents understand that the treatment for that is actually stool softeners or Metamucil or fiber or something like that. And they think, oh my gosh, it keeps making them go. And then they want to stop giving that. And then it kind of restarts the whole process. So making sure that parents understand that treatment should be ongoing for quite some time and not to stop it without physician consultation.
And super important for us as nurses to note that they're taking that they may need to leave the classroom quickly to get to the bathroom, and having that access, I think, is important.
And sometimes the clue to that level of constipation is frequent urination. And so oftentimes the child's asking to go to the bathroom, and we all know that that's a pretty common common excuse to leave a classroom. And I know teachers are it's very disruptive for the teacher, but sometimes there's an actual organic basis for that. So something to think about for sure. And it's not always a UTI. Sometimes it's constipation, and that's the reason they're having the urinary symptoms.
As other people are thinking about cases to share, Cindy, really quick on the case that you shared, what would you have done differently if your communication with the parents wasn't as strong?
Yeah, I think it would have taken a lot longer. I think we knew fairly quickly that it was stress related only because it was always the one class. If this would have been generalized anxiety about school in general, I don't know that we would have caught it as quickly, but we saw the trend. It was always one teacher's class, and they rotated to that classroom, and the other teachers weren't having that issue. Without parent support, I think it would have been a lot harder to instill the different education pieces that we were able to do with her, and probably not had gotten her into counseling. Yeah, I think it would be much harder if you didn't have parent communication in that case and support, which we didn't initially think we would have had the support. I was really shocked, to be honest. I had said it'd be really great if we could get her into counseling, but there's no way this parent, I really didn't think she would do it because they don't typically partake in the mental health stuff. So I'm glad it was stress. It wasn't something super complicated.
Thank you, Cindy. There was someone asked a question in the chat, so I'm curious if anyone/district has done something to promote better nutrition.
It was crazy. So we just had an audit in our nutrition department, and one of the things that they audit when they come in is the machines outside that the kids can purchase stuff in. And so just us as staff were going over it, and there was like protein bars and fruit snacks and chips. And so when we said, oh, when they come and see this, everything's going to get pulled except the protein bar. What was opposite was everything got left. The protein bar is what got pulled. I was shocked. The Lay's chips are air baked. The fruit snacks passed. They didn't have enough sugar to pull them out. But the protein bar, which is what I figured would be left. And then when they looked at we had Gatorade and Bubbly, I think is the name of the brand, and then water. The only thing that we can have in our liquid is water. But our school works really hard. We just recently got connected. We do a lot of work with farmers around the area to bring in fresh vegetables and fruits to our cafeteria. And then we highlight those farmers, and we also bring them in to talk about how they became farmers. And we have a high Hispanic population. And so we try to be very specific about bringing in farmers that started off as migrants and have worked and owned their own. And it has been amazing. And we highlight that on our Facebook page too, to our community. And being able for our students to be able to eat some of the fruit and vegetables that are growing in our area, I think is huge.
Has anyone else done anything different or similar?
Well, I'm not a dietitian in the schools, but certainly every school has different, I guess, policies. Teachers can have different policies in the classroom and things like that. But even just something as simple as a water break once in a while during a school day could probably promote water intake for kids. I always feel like they're being rushed to different classes and then rushed at lunch and things like that. So implementing those breaks during the day to just have a minute to think about their health, which is drinking water, and then if there was that ability to promote the foods with fiber that will help kids poop.
I really like that, Kelsey. And I'll also add, I think we undervalue the importance of bowel training in kids and routine. And that in itself, you touched on it with society and the way we're always rushed, that it lends itself to kids being constipated and tends to be a large part of some of the stomach issues we see in schools.
Tracy, I agree. It's funny because I feel like you get bathroom privileges, but some of these kids just need to be able to go to the bathroom and not be rushed. Like, I don't think bathroom break should be a privilege. It should be something that we get to go do. The kids should get to go do. And it's like, okay, you guys have 2 minutes and then you need to be in the classroom. And I do think there are some kids that might abuse it for other purposes, but it's pretty easy to figure out who those kids are and then just be monitoring for that.
So Tracy mentioned like educating students about like their bowel movements. As far as like stomach complaints, what might be other um I don't know, preventative or educational methods to like share with students? Like just bowel movements, or like what else should they be looking like students know about?
I would say at the middle school level, talking about bowel movements is very popular. Anytime you talk about poop, they love it. But one thing we did in our middle school a number of years ago, we really asked kids about breakfast. I mean, we served breakfast before school. And when we surveyed our kids, a lot of kids wouldn't eat breakfast before school because either they had breakfast at home or they didn't like eating that early. So we moved our breakfast to later in the morning, like around 9:30. And the kids that ate breakfast, the number of kids that ate breakfast went way up. But the other thing that happened is we saw that hours that we had the biggest discipline problems were the hours before lunch. And by moving breakfast to later in the morning, those discipline problems before lunch almost became non-existent. Because why were kids misbehaving before lunch? Because they were hungry. And that's middle school, especially middle school boys. They could eat 3 or 4 times a day and talk about poop 9 or 10 times a day. But anyway.
I see if we have students that come in and we talk about, and I of course get permission to have these talks, and I can't remember what it's called, Noreen, you'll have to remind me, but the poop picture that has the different types of poop, what normal poop should be, the cobblestone. It's like
Bristol?
Yes. So I show that to the students. This is what normal poop should look like so that they can monitor their own poop and see if that's that way, if it's not normal, if they don't feel comfortable coming to me, they can go to their parent and like Miss Cindy said, it should look like this and this is what I'm seeing. And then they can follow up with me if they have questions about that.
Randy, I love that elegant solution of just changing the breakfast time. I have an opposite story where there was a school in Nampa that shall remain unnamed, that there's always one day where there's a lot of abdominal pain after lunch, and it turned out it was burrito day. And so I've actually had to speak with kitchen staff before, and I didn't look forward to it, but long story short, we were able to change burrito day. Burrito day did go away, and lo and behold, we had way less abdominal pain, at least for that particular day. I don't know what they were putting in them. Probably too many beans.
Thank you. These are great stories. I appreciate everyone sharing. So another question, how do you accommodate for students who have known GI issues? So like maybe IBS or food allergies or something. Like how do you usually work with students like that?
So we have some like dairy intolerance is one of the things that we have a couple students here that take medication before they have lunch. The bathroom breaks, having that is another issue. We had a kiddo, it's not gastro related, but I thought it was when I first saw him, painful. What we thought he was telling us was he was having painful urination. And he was also the complaint from the teachers was that he was just a little more fatigued than he had been. And so mom took him back to the doctor. But I truly thought there was something going on that was urinary tract or constipation causing more urination. And through the migraine, involving everybody, found out that it was cancer.
Thank you, Cindy. Are there any other kind of considerations or accommodations that like should consider when working with students with known kind of gastrointestinal issues?
Cindy, I wonder if you might talk about bowel training or like how kids should sit on the toilet for a certain length of time and the physical position they should be in.
If you want to, I mean, we talk about having a chair like or a stool that they can put their feet on to make them feel more relaxed. Something that I will talk to them about is we never rush that. If you feel like you need to sit in there longer, we've changed the culture around here a little bit. Like water bottles weren't even allowed in classrooms for a while, and now that's kind of changed. And it took a long time for teachers to feel comfortable doing that. There was a lot of pushback because a lot of our teachers are long-term teachers that have been here, so change is always hard. But I think, like you said, Randy, you change some things and you start to notice there's some good outcomes from that. So the water bottles now are a big deal. The other thing that we found was that with water bottles that our dental caries went down because we have screenings every year. And I truly feel that having the water at the desk was the biggest change that we did. I really don't feel like our students are brushing any more than they were, and the education is still pretty much the same. So I truly attribute our dental caries when we invite Southwest District Health is who comes out and does ours, our numbers have been much lower in the last couple of years. And I truly think that that's what caused that. And it wasn't intentional, but I truly feel that's what was going on. But if somebody else wants, Noreen or Leanne, if you want to.
Well, it goes back to what Tracy was saying. I mean, there's so many kids that honestly just don't like to go at school, right? They don't like to have a bowel movement at school. So there's a lot of things that you have to put into place, right? And it might have to be more formalized, like in a 504, where you have to be very specific. So toilet sitting, usually 5 minutes is a good place to start. And honestly, usually you have to have a timer there. And sometimes I say just give them a book. Otherwise, it seems punitive, right? Because if you're made to sit anywhere for 5 minutes, especially if you don't want to, it's like somebody saying you can't scratch your nose right now. You don't want to do that, or you want to scratch your nose. But sitting somewhere for 5 minutes can be very punitive to a grade schooler. So just making the plan very concrete so that the teacher doesn't have to guess what you're wanting, and the parent doesn't have to guess, and that the student understands that it's not a punishment. I mean, those are all things that need to happen when it's someone with, for instance, chronic constipation, obstipation, where they're having, like Gina mentioned, the leakage around the large amount of stool in the rectal vault. So yes, I guess the more specific, the better. And having a stool, like you said, Leanne, there so they're more relaxed, and maybe a book. I'm not sure if that answered your question, but
We
again,
also have a separate restroom. It's a single restroom that's separate from the one that all the kids use. And we have certain students that have a privilege to use that restroom.
Yeah, and I kind of go further in that if you want to bowel train a kid to poop at school, they're going to poop at school. So we should be setting up systems to bowel train so kids poop before school, and giving teachers and kids that power so that they don't have to deal with a lot of this stuff. And so 21 days to make or break a habit. Before bed, make sure you're eating fiber. I love the farmer thing. Give some blueberries or some fruit. In the morning, have some water at the bedside so they drink water before they even get out of bed. And then they go start getting ready for school and then sit on the pot. And you have to tell parents for 21 days, you got to do this. and you will train their bowels to go to the bathroom. And if they're on meds, then you give the meds at bedtime, not in the morning, because then they end up pooping at school. So, and they don't want to poop at school, which causes, as Noreen said, is part of the problem. And so create and do the bowel training so they're pooping before school. That's my 2 cents. Because if we train them to poop at school, they're going to poop at school.
Tracy, before you go too far or turn off your camera, what do you think about, like, if this is something that needs to be, like, if someone a student comes in with a stomach issue and it needs to be escalated, what do you think will look like the next steps, as far as, like, does the school nurse need to do something to transition the student to like a medical provider? Like, what do you think that should look like?
Yeah, I think looking for patterns and trends of information and documentation, and I'll have Cindy and Noreen or Leanne jump in as well, but I would look for patterns or trends over a period of time without improvement based on the interventions that have been implemented. And then I think it's prudent to recommend that they go see their primary care provider, their pediatrician, and or a GI specialist. The rest of the group.
Tracy, I agree. I think we implement things like increase your water intake. We're trying the fruits and vegetables and fiber. And I think usually when you have a constipated kid, it drives the parent crazy too, right?
Mm-hmm.
The parents are helpless. They feel helpless. They're not helpless, but they feel that helplessness. And so when you have tried all the things, the 5 minutes, put a stool there, and still having those issues, I think that they're open to seeking care because they're frustrated too. Because it becomes something that's kind of consumes the family.
Mm-hmm.
I found that working in the schools that parents really have a lot of trust in their school nurses. And you guys really get to know these kids by first name. It's amazing how many, because a teacher knows all their kids in their classroom, but the school nurse has to know. I don't know how they end up knowing all the kids' names in school, but if you think that a child needs to see their primary care physician, or provider, you're probably right, is what I found working in the schools. And if you call that parent and say that, they'll go. So I think you should just use, just like I tell parents have this special intuition about their kids. I think school nurses have that about their students. And so I would just trust your instinct. If like, this isn't right, even though if you think that, even if there isn't any specific thing to hang your hat on, I think you should go with your instinct, because I think I've always found that to be correct.
I agree. And I think the other things that I am really cognitive of, if I'm thinking there's a constipation issue, I'm at their lunch hour and I'm looking at what they're eating, and I'm at their recess. Are they out running around? Like, those are two things that I also pay attention to. Are they the kid, especially junior high kids, they'll get out of, we have kids that don't want to eat in front of each other. We have kids that are like, they want these special diets, or they're not eating because they want to lose weight. Like, those are things that are super important too. And then we talk about that as well.